Let's talk a little bit about whether or not the vaccine rollout can be and will be done more efficiently than we've seen in the first couple of months.
Well, I hope so. I mean, I think just generally with anything new, there's going to be a learning curve. So as we move along in this process, things should get more efficient. And on top of that, we have a more comprehensive plan. I mean, the more community resources, Amazon is a big giant, but Biden's plan also includes community centers and getting more smaller practices and smaller local resources involved. So I think that that's going to be more efficient and effective as well as things move forward. But we are still going to have some hurdles and obstacles. So the issues that I see as we move forward are some of the same things that we've had as we started this process as well. I mean, there are issues with actual manufacturing of the vaccine. It's not going to appear just instantaneously. So that's still going to take time. In terms of the vaccine, right now we have two vaccines, Moderna and Pfizer. Now, Moderna has to be frozen. Pfizer has to be ultra cold, which means it's stored at minus 70 degrees Celsius, which is extremely difficult to do. Only certain centers or hospitals can actually store the vaccine at that level. And in terms of shipping, it has to be contained on dry ice. So that also makes it very difficult to transport and store and then administer, which makes it logistically difficult for patients to be able to get. There are some logistical issues in terms of being able to order the vaccine, so that may still be present. I mean, for example, I'll just say this comes in vials of 975 units. So if people open it up, they actually have to administer the 975 vaccines at once within a certain time period, pretty much that same day. So if you don't have 975 people to administer it to, then whatever doesn't get administered will go to waste, which seems like, oh, 975 people should be easy to find. But then you have debates about who actually qualifies to get the vaccine, who's on tier one, who actually is over 65, who's a healthcare worker, who gets priority. So we have some issues with that as well, which has led to vaccines going to waste and then caused people to actually order less vaccine because they don't want to have an issue related to either having vaccine going to waste or having to dump vaccine, right? And then we have uncertainty. There's lots of forms of uncertainty.
Sure.
So that also has caused issues.
It sounds ridiculous to say or think that you're throwing away vaccines that could be viably administered to somebody. You're a medical doctor. You work at NYU. You've also got a private practice. Can you take us through some of your own experiences with regard to the vaccination protocols and practices? Are you yourself administering them? Are you planning to? What exactly are you doing as a doctor in your capacity as a medical professional?
Well, I've received the vaccine through NYU, and then I've actually, through my private practice, applied to be a vaccine center, a distribution center, so we can give it to our patients. But there are issues with that. So in order to become a vaccine center, you first have to get registered. Now, if you're a primary care office or a pediatrician's office and you already give vaccines, then you may already be in an immunization registry. But right now, for example, we treat patients with cancer-related pain and other things. We don't usually give vaccines, which is true for a lot of the community resources that the Biden administration is looking at to help with this process. So if you think about it, even with a website to be able to become a vaccination distribution center, there are technical issues with the website. And what I've noticed is with the city, the help desk, the number that you call is the same number that everyone in the city, whether it's people who are calling about the vaccine or healthcare providers, it's the same number. So you can get into a big logistical backlog and have issues trying to call for help. So I think in terms of staffing, there are administrative burdens. So some of these issues, can be addressed further. And then there are technical issues in terms of we're still being asked to volunteer elsewhere to help administer the vaccine,
Sure.
which I think a lot of healthcare providers are happy to do. But it's a lot easier to actually volunteer in your own setting, in your own healthcare setting, versus to volunteer in a completely different setting. And the advantage of doing it in your own setting is that there are a lot of people who prefer to come to their own doctor's office because they trust their doctor. They know the setting. They might not have to worry about long lines where there might not be as much social distancing, of course, and maybe being exposed to other COVID patients with COVID or sickness. Whereas if you go to some of these large sites, you might see other people who have illness as well and symptoms, and you're not sure what you're going to be exposed to. I'm not trying to make people worried, but these are things
Right.
that people have concerns about.
Shepard Smith here. Thanks for watching CNBC on YouTube.